I want to spend the next 20 minutes, 30 minutes, high impact with our friend Lawson. But before I do, I want to remind everybody as to why we're talking about what we're talking about today. Practice Habits is a session that we have every single week, almost every single week. There will be a break over the 4th of July week, and there's some other breaks depending on national meetings. But we try to do it pretty regularly. And the whole goal is to try to give back to those who have mentored me along the way. It's hard to run a practice and it's lonely at the top. And doctors have their mentors and friends, and it doesn't seem like we always have direct access to all of our admin counterparts. So, this session, there's no sponsors or anything like that. It's just straight talk on what we can use from each other to better our practices. Sometimes it's from practice partners, sometimes it's from vendor partners, clients, and friends. Now, it's going to be strange, but today, Lawson, you're one of the people who I've known the least in these sessions,
Yeah,
and
yeah.
I'm really excited to learn from you today because one, I think we we have a lot to learn about just AI in general. Two, because all of the people that I know and respect you, and that goes a long ways as well. It's a speed of trust kind of conversation. Um, and um, and I will say, Kate in particular speaks very highly of you and your relationship, and I'm wildly jealous of that because I've always thought that he and I were BFFs, and so I'm sad to hear today that it's like a breakup. It's like a public breakup, I guess, and one of us is making it a big deal.
I just feel like you're blaming me, but I'm not the one that ignores my text messages. I just
I
feel
feel
Oh,
like
like I'm
we
back
should
in I feel like
put
I'm back
this
in
listen,
on
high
we
you.
school.
I
And like
opened up a can of
my
worms I
I'm
shouldn't have.
and I'm dating
So
I'm stealing my best friend's girlfriend or something like that. But yeah.
yeah.
So
So we've got a mix here of friends we've, from industry, from practices. Lawson, maybe give us a little bit of a background of what you've been working on prior, and
yeah.
then your most recent, how that lends credibility to what you've been working on with Revival Health. Give us your background and story.
Yeah. So I'm a computer programmer and entrepreneur. And I had some success in the oil and gas business and thought that I would go into medical and
I got
oh,
it.
there's a little bit. Um and yeah, I thought I would it'd be really easy. I'd go build this software platform that would work really well, and it turned out it was really really hard, and and I yeah, I ended up having to figure out how to work with all these different systems, these different workflows. It was and I didn't do what I thought I would do. I ended up like spending all my time, you know, solving interface issues and different workflow issues and um, you know in 2021 when it became clear that um, the company was called Vital Interaction that I started then, and I guess in 2021 it became clear that my business partner and I had a little different view on the future of the business, and he and I are still good friends, great guy, but it just became clear that we needed to sell the business, and I had wanted to start focusing on, we called it automations. Now people would call that AI. I won't get into the background on how we got into it. I was telling Kate or somebody earlier today, but ultimately I wanted to build automations that would help my customers because my heart is really about just helping people and helping patients. And the whole reason I got into medical was because I really did just want to help people, and I hope that comes through in everything we do. But ultimately, my heart is to help my customers not have to do mundane, repetitive, administrative tasks so they can serve patients well. And um, I hope I dream and pray and push every day our company to do that and to serve practices so they can serve patients better. And ultimately, we give a piece back of every process we automate goes towards life-changing procedures, and we have a dream of doing 20,000 a year of those one day. That's our story.
Yeah, I want to talk more about that here in just a minute, but give us a sense. I know it's not your business that you primarily focus on anymore, but give us the 1-2 on what Vital Interactions does and what
Yeah,
it did and how it contributed to your thought process around
yeah,
what is now Revival Health.
yeah. Vital action is. all intensive purposes, a
Oh, since the
patient re-
purpose of it.
patient reactivation, patient engagement platform, and um, ultimately it's a data. I mean, it's really great at pulling in a lot of data and surfacing that, and then automating different, mainly outreach to patients so they can call them back. And similar theme. The goal was to ultimately help make sure patients got treatment and care, and still out there, still doing well. Still have team members that I worked with that I still love that are there, and proud that I was part of that. Revival is really about building, training, and managing, AI agents or autonomous workers. And so we ultimately build, train, and support those workers for our practices. And we do, a variety of those. We have about 50. Actually, I just looked at this, 44 ophthalmology customers. And many are many of the are the notable groups across the country. And we build, manage and train their workforce. And that's anything from a call center agent to a payment posting agent to a eligibility authorization agent, and surgery, you know, cataract surgery estimation agent. But all of those different things are things we do to free staff up so they can focus on patients.
Okay, let's talk about that for a second. So,
Mm.
you've created agents to help with kind of pre-visit, post-visit workflows or communications. Give us a sense of what you mean by that.
Yeah, I mean, well, it's, I mean, if yeah, just to if when I think, and you guys please forgive, but when I go look at the work that a front desk person is doing at a medical practice, it's a checklist of 20 things. And so it could be everything from, validating demographics to making sure you've got the right, insurance plan attached to the patient's chart, to answering a phone call and scheduling an appointment, to, checking up, making sure eligibility is set correctly, pulling an authorization, um, making sure there's not a balance on the patient's account. I mean, there's I could probably keep going, but there's a ton of things that need to happen before a patient comes in and is seen. And then, and Canada, there's a ton of different systems that do that, right? But every single practice is typically using one or more systems to validate and do that work, right? They may be using Promptly, they may be using Clearwave, they may be using, you know, vital interaction. There's a variety of things, and so a person's having to go navigate and work in each of those systems, do that work, follow that process, enter that in, and that's a fair amount of labor. And we build AI agents to do that, right? That do that labor and do 80% of that work, and then tee up ideally the 20% that needs more human work.
Got it. So your goal isn't to help reduce overhead and by way of workforce, but more to reduce the friction of rework, incorrect work.
Yeah, and I would say incorrect work, and then I dream of and you guys may have practiced to do this, but recently have been at the doctor a ton with my mom, and I just dream of someone having time, and being able to connect with them and talk to them, and have not have so much administrative work and burden that they're doing, you know. So yeah, ultimately, I think our true dream is that patient service is better, right?
Yeah.
And not having to do all this other stuff. So
Well, and listen, we know that the healthcare experience is short of the airline industry, and I mean that, the worst experience in commerce today.
mhm.
And so anything you can do to help um, afford more time for the human touch in every sense, I think is really valuable. So give us a sense. I know that I surprised you by saying that you can show some slides if you'd like to, but I also you don't have to. But give us a sense of how you would talk to a practice or present to a practice what your value proposition is, and are you typically sitting down with the doctor um,
Yeah.
and the administrator, or how does that work? Who's your
Well,
audience?
This Cade would tell you, I'm typically trying to talk them out of it. I typically try to tell them all the reasons they shouldn't work with us. But I yeah, our value prop, and I don't think we're for every I don't think our business is for every group. I think they need to have a shared value of wanting to provide exceptional patient care. I think they need to care about their patients. I think they need to care about their people. So I think like that, like shared, um, I don't know if you want to call that mission or value, is probably the most important thing. And then, yeah, and then I think it's about how can I utilize my most talented people in the most effective way to start to, to ultimately serve our patients the best way. And ultimately we're all playing baseball and trying to make money and increase the profitability or of the practice. And so, um our value prop is that we do that, right? Like, if we find the right partner and the right relationship, we will provide ROI, significant ROI. And it will, no, it doesn't mean it doesn't require a lot of work. It doesn't require a lot of change, but I have a ton of confidence in our ability to deliver ROI through technology, and that's why we do it and what we do. And that's, I think, why people work with us and hopefully and refer us to their friends.
So, for fear that that's your opening line when you're trying to convince a practice administrator or a doctor that
Mhm.
they shouldn't work with you, maybe I'll give you another run at it. What do you what do you say to them to to get them enticed about, why you could help them, how you could help them, and
Yeah,
what does
that's a
that engagement look like? Are you doing a demo for them? Are you making a solution, agentic solution customized
yeah.
for them?
Yeah, I mean, we're typically selling to the practice administrator, and
Mhm.
normally our business is word of mouth. Um, so we are normally understanding, trying to understand where their people are spending time. Once again, where are your people spending time? Where are they spending time that could be better utilized elsewhere? And so we are trying to understand that first, and then we can show demos and videos, and we can show them agents taking phone calls or agents going to websites and pulling authorizations, or um, you know um, filing claims, or you're posting payments. We can show demos of all of those things, but I know some of them need that to be able to understand and wrap their heads around those things. But ultimately, we're just trying to understand the challenges they have and where they're spending that time and how that time might be utilized better to help them once again you know make more money and serve their patients better. And it's typically that simple.
Yeah, you mentioned a couple of things there that I think are valuable notes on some of the tactics you might deploy for practice. One of them, you mentioned, we can secure information from the insurance company for pre-authorization upon check-in. We can do some of the pre check-in process. You said you're doing some pre-visit phone calls. Is that education based, or is that just getting people ready to come, reminder calls, things like that?
Uh, Right now, we're not. We don't do any reminder calls. We only do. I would say we're on like pre-visit stuff. We're typically going to be doing. I mean, everybody has to have someone go run eligibility in their practice, right? They're running it through Clearwave, they're running it through the practice management system, and they're running it through their clearinghouse. We automate. Like, we have a bot that goes and does exactly what a person does on that, right? You're typically having, for certain procedures, you're having to go get an authorization from Availity or from United Healthcare or or VSP. If it's an optical, right? We would go, and you're having a person that logs in and goes and does that work, and it takes many, 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 many minutes, right? I mean, 5, 10, it depends on and we do a big chunk of that, right? And so that's some of the pre-visit work we do. We, um, you know, I it's going to maybe get out of my lane here a little bit, but I think a lot of we will build cataract surgery estimates, because I think people are wanting to talk to their patients about what it's going to cost out of pocket, and that process of calculating those estimates and out-of-pocket costs is not simple and not easy for just any person to do. So we built an automation that does that so people can have those conversations. Those are
Now,
all. Mhm,
while you pull up some of your visuals of some of
mhm.
those kind of tactical pull-throughs that you have your agents work on, I guess what I hear you saying is that you can give a person before they even come in as close to an up-to-the-minute estimate of what their patient responsibility would be for their portion of the cataract care, should they be a candidate. Is that kind of the way I'm understanding it?
Yeah, that's an example of a automation we have done for our practices. That's an example of something where they have people doing that work, and by doing that ahead of time and having a bot or agent do that, it saves them a ton of time and hopefully empowers them for a conversation with the
Let's
practice.
role play how that looks. I'm a practice who wants to utilize that part. First of all, is it custom every time, or is that something that you've been kind of saying that you can do for them as an off-the-shelf offering?
It's some of both. So everything we do is a is has common components we built that we're able to reuse, and then there's typically a piece of it that's unique to the workflow, right? So I'm thinking about some of those we do, and like I'm going to take two different practices, both from the South. One, we are doing I would call it much more of an estimate, and we're actually like basically creating this in a spreadsheet, and attaching it to the EMR and putting it in there. Another, it's a true like, I mean, I think they're going off of it to like collect the money. It's a true actual estimate. They don't want to detach the EMR. They've got a little different format, but we're using the same components to build it. It's just slightly different, so they've been tweaked slightly for each practice.
Okay, awesome. Now, if you're showing your screen, you are showing your screen, but we're just seeing the lake in case you're
Oh, are you?
trying to
Oh,
show
let me
slides.
let me
Yep.
show the right one. Let me see here. Stop here. Pick the right one here. And you're just getting like what's on my mind right now, or something I've just been working on. And this doesn't mean that you asked for me to share.
Yeah.
This is actually me thinking about some of the workflows I've been thinking about, and in particular, what like I spent a lot of time thinking about how practices need to change their workflows, like the way they do business today, and the way they operate. I spent a lot of time thinking about how the workforce needs to change, and how the process of how they do things today needs to change. And this in particular is one I've been thinking about related to medical authorizations. I won't like bore you guys and go through the entire thing, but maybe I can show a couple of slides that are that are interesting around that.
Yeah, I think that'll be
Um,
helpful because I think everybody wants to understand, how this works in real time in their practice, right?
Yeah, I mean, so this is me showing like how a workflow would change in a practice, and it starts with like right after a patient has like the day after, or maybe the night after the visit happens. There's a ton of stuff that needs to start happening for the very next visit, and one of those things is figuring authorization. So maybe
Okay.
surgery orders, but all of this should be happening, and there should be a process for that, and there should be a human and or robot kind of process that's happening right there. At the same time, there's eligibility and payer things that need to be figured out for all your patients that affect authorizations, and both those are independent kind of workflows that are automations that would be a combination of people and processes. And then this is the part where the actual authorization happens. So this is just me trying to visualize how the workflow would look in a practice, and the different flows. I've got another slide over here that may do a better job of that. But I call them bus stops, but those are them. Um, Here's another one. Like you basically have
Okay.
the clinical part of it, which shows, provider finishes the visit. There's all kinds of stuff that happens, and what's going to happen on the next appointment, and part of that. So that's kind of layer one. Layer two is what does the insurance require, and then layer three is how do you execute on that. And those are three different, once again, workflows that have human and or agents doing that work. And listen, these are things I've been thinking about a lot because I work with so many of our customers, and I realize they're gonna have to make use of AI. They're gonna have to change the way they do things today, and that's going to be so. These are conversations I'm having with them about how these workflows and how these things change. So,
And what are the prompts? I mean, what are the things that initiate this process for these agents? I mean, a patient is scheduled, and so does the agent just start then doing some pre-authorization work, making sure there's stuff in the record that can be submitted
so
to insurance, checking
yeah,
benefits?
yeah. I mean, I'm gonna give like let's try to like take a concrete example, and maybe all these other there's probably a ton of experts on the phone or on this thing that'll find things I'm saying wrong. But when I think about the doctor, they're seeing the patient, right? I have my visit, so I really think it starts the the minute after or the right after that visit. So I see the doctor and he says I want to go. I don't know. Maybe we agree to do the some type of cataract surgery or glaucoma or I don't know what it is, but something like that. And there's maybe there's medication orders that need to happen. There's um, but bottom line, he's probably got a list of stuff that should happen that will have to happen before that visit happens. So that like within immediately, right? So I'm going to just focus on authorization. But so let's say it's glaucoma or some type of cataract surgery that actually requires a prior auth, right? So that knowledge happens at that visit, and that would kick off a workflow and a process, right? So um, to basically begin the process of of getting ready for that next visit. And so simultaneously you've got eligibility and author eligibility processes that are helping you determine which payers require authorizations. And so between these two automations you would then be able to build out and be able to know how to run that authorization process, right? So ultimately um, you've got these processes that are running independently and helping determine like getting that authorization pulled and or kicking it to humans along the way. So it's yeah, it's conceptually it's like I think of them like assembly lines in factories of these processes running and doing the jobs and kicking out the bad widgets for humans to fix, putting them back on the lines and making it happen. So these are at least been my thoughts on how what that looks like for authorizations and trying to put that together for folks. So
I like that as a concrete example. That's very helpful for the authorization part. Are you doing anything pre visit? You mentioned the example, at least with the authorizations. This is post visit, right? That you just met with your doctor. They just diagnosed you. You've got glaucoma, and we're an interventional practice. We're going
mhm.
to get you scheduled for the next couple of weeks, and then this system seems to run itself. So there's real clarity about what's covered, what estimates might be, perhaps what even procedure might be covered versus other ones based on what's in the record. That is that right?
Yeah, that's how I would envision it working. Correct. Right. And
Okay,
those
got it.
rules would be specific but to practice and by yeah. So that's and you would, obviously you're gonna have checkpoints along the way, right? Like if eligibility typically is being done a week before by people, people are doing all this work ahead of time, but this is just me envisioning how this continue how humans and these kind of work agents kind of work together to get these jobs done. So,
And if we're looking at the whole patient life cycle, within
mhm,
the continuum of from their phone call, to schedule their
mhm,
exam all the way to when they're leaving the consultation, your
mhm.
automations, these pieces of the architecture, as noted, cover really just that post-doctor portion, or do they cover any other points along that continuum? Because
We
I know
we work across.
you got voice
Yeah.
agents too, right?
Yeah, we work across we do every job other than scribing or parts of every job other than scribing and being and the doctor itself, right? So I think we do everything from revenue cycle billing jobs to front desk and call center jobs to um, probably even some of the write-ups or workup type work you're doing for medical technicians. We'll read paper cataract surgery notes and enter those into the MRs. Um, you know, so a lot of we touch typically every administrative role we are touching in some form or fashion, and ultimately I think we'll help redefine the way the work is done and the workflows, right? And when people interject and work in those workflows, which is what I was trying to ultimately get at here. But yeah,
Yeah.
we touch every probably every admin role in an ophthalmology practice.
So then is your billing then for your offering, is it variable based on the practice? Depending
Our
on what kind of
billing is
solutions
actually
they're prescribing to?
our billing is standard. It's usage based, and people are able to commit to basically the larger amounts people commit to, the cheaper the rate is, and so we're ultimately um, typically going to be a little bit cheaper than people, um, and and but ultimately it's you compare us to you should be able to compare us to what it would take a human to do it, how much it would cost them to do it, and we ultimately guarantee that, right? So if it's taking a human 160 hours to do the work, we would guarantee we'd be able to deliver that for a cost under that is how we would typically do that for folks.
Okay. Now, before we kind of get away from your slides here, any
Mhm.
reason to showcase your voice AI to talk about how you would coordinate a cancellation or a reschedule or something like that? Because that's another component to what you're
Yeah,
offering
happy to
too.
share that too. Let me go find a presentation on that. But yeah, that's we have a we happy to show a quick voice AI thing as well.
Okay, that sounds great. While you're digging for that, I know we've got a lot of folks on the line, some of which are big Lawson fans. What questions or things do you have to add, audience, for what Lawson is working on with Revival? Any questions from the group?
I sent in one into the chat there, Matt. I was just curious about obviously voice agents I get for like rescheduling consults, no shows, et cetera. But just wanting to hear what his thoughts are on the initial lead to consult side. Like, how far along is he seeing how the tech is, to kind of be able to handle leads, say from Facebook or Google and whatnot. Just kind of curious what his thoughts are on how good the AI is now.
So say that again. I want to make sure I capture that.
Yeah. So using a voice agent for paid media leads.
Man, I don't know, Michael. I mean, that's probably out of my wheelhouse. Um, yeah. When I think the people get annoyed the longer. I'm say what I'm seeing. Like if I'm asking a ton of questions with voice AI and agents, people start they start getting frustrated right now. So if I
Yeah.
run
Yeah.
somebody through like a 10-minute question answer, like it's ton of them are bailing out. So I think there's a little bit to do. Like, so I don't know enough about which like if it could
Yeah. I
be
got you.
like
It's fine.
if it could be under like 3 minutes, like any type of voice AI to me that's under 3 minutes is um likely a
Yeah.
a good use case for something like that. If you start getting
Yeah.
up
Makes
over where
sense.
it's 10 minutes or 15 minutes, it just like
Yeah. I got you. Yeah.
it becomes problematic for people.
Kate, I might call on you for this because I know that you, in Dallas, you can even jump in on this, but you being at the helm of Boost for so long and using some AI for, digital uh, conversations, anything to add on the AI based follow up on leads or lead nurturing commentary?
I actually agree with Lawson's philosophy. I've heard him present on this a few times, and not just kind of paraphrasing what I've understood to be his philosophy is, let the AI, like in this case, voice agent, do the basic uh, tasks, right? Just tasking, save time, and let the humans do the human thing. And when I think about just the countless number of call recordings you can listen to with patients asking questions and sharing their fears and their concerns, voice AI just doesn't have the ability to listen and to empathize and to feel. And so I'm thinking of a patient that was extremely, she's an older patient, terrified of cataract surgery, had all kinds of questions. And the agent didn't have any clinical answers to the questions, but she could listen and feel and empathize. And so I think when it comes to new patients, they're too valuable to hand off to AI. And so AI should do the basic stuff and save time and empower the team. And all, particularly new patients should be driven to a human so humans can do human things. So that's what I think the best practice and best approach is. And I've really learned that from Lawson. And I think Joel at Navigate has a similar philosophy, and I think he's right.
I tend to agree with you, and I think that there's some good evidence to back it up, Cade. And Navigate's a good example, right? Because they've got a single goal, singular solution. And what I would just challenge that thinking with, and I think that's what everybody on this call should do with one another is, um, do you have somebody at the front who is solely focused on being that empathetic, high EQ voice who is a human? And if not, then find a partner who is. Um, because I think that not answering the question, not having the responsibility of answering the question, and not having the high EQ, then I think that an automated AI generated version that is complete, that might not have the EQ, is better. Okay, but I'm always going to opt for a human, as much as possible. So I mean, I just think that that's the challenge that we have right now is many practices don't want to adopt an AI-based solution for any of that automated, at least voice-based work, yet they're not willing to hold their team accountable to do that work in spite of it. And I think that's a real tough place to be because people have come to expect, even when they're calling a movie theater now, I'm going to have some level of interactivity for a custom, flow through this phone tree. And so I just think that we need to be better at the practice level at either
Yeah, I
outsourcing or
think,
holding our team
yeah,
accountable.
I think you nailed it. I mean, I see three practices on here that I think are perfect example. You have Myra, you have Melissa with Dell, and you have Vance Thompson's practice represented on here. And you think of the patient experience that the patients get when they walk into one of those practices and the experience for a new patient being followed up with, whether it's from a marketing lead or whatever, should match the same level of standard and quality and excellence that they're getting in the practice. And I think voice AI will never match that standard that many of the practice leaders on this call have created in their own practices. So I think it's for basic stuff. I don't think it's for human stuff.
Yeah, I think that's right. And the thing I get excited about for you, Lawson, is it sounds like you've started with the mundane, error-prone work that nobody wants to do, even humans anyway. And it might be harder to do so error-free. And so that's been your high ground of where to start. Yeah, why don't you play one of these for us and let's see how
Yeah,
I'll get
let
you
me see if we
articulated.
can find one here. These are a little old, but I think I can make
Thank
them
you for
work.
calling
Can you guys hear that real quick while I play
Yes,
that?
we can.
Was that coming through? All right.
Yep.
Thomas I Group. This is Aileen, your virtual agent. How may I help you today?
Reschedule an appointment with Dr. Berman.
To assist you with rescheduling your appointment with Dr. Berman, I'll need to gather some information. Could you please provide the patient's birth date? Thank you for providing the birth date. Could you please provide the patient's first name?
Sharon.
Thank you, Sharon. Could you please provide the patient's last name? Thank you for providing the last name. Please hold on while I look up the appointment information for you. I found your appointment with Dr. Berman scheduled for September 3rd, 2025 at 10 in the morning at the Woodstock location. Would you like to reschedule this appointment? If so, do you have a preferred day or time in mind?
September 3rd in the afternoon.
Let me check for available appointment slots on September 3rd in the afternoon. Please hold on for a moment. I found several
Lawson, do you
available
mind pausing
appointment
for a
slots
second?
for Dr.
Sure.
Berman at the Wood. Thank you for calling Thomas I Group.
I'm just curious, one of the things we talk about, great job, by the way. I do think that for some of the mundane thing that takes a lot of time for our
Mhm.
frontline folks, I do think that it's extremely helpful to have a solution like this that can um, help with that task related offering. Um, One of the things that I'm wondering is from a customization standpoint, how deep can you go into the practice's system? For example, that patient prospect said they'd like to move it from wherever to September 5th, and it said we'll go
Mhm.
look to see if that appointment is available. Are you able to create an agent that soft walks somebody towards an earlier availability to front load the schedule?
Yeah, I mean, I think we can ultimately build whatever rules the practices want into that scheduling, right? So like, I mean, this is Thomas Eye, and I mean they have a large, I'm going to give an example. They have a large pediatric population or larger that's super complex. So that's one of the things we're trying to figure out early on and get the people on. They have us getting their cataract surgery appointments to people as quickly as possible. So we're customizing those to the workflows of the practice. And then we're able to use any tool in the practice management system, right? So like we can task task people in the practice management system. We can look up, we have the same data available that their call center staff would have available to us, in
Hmm.
real time. So we're basically navigating that website in conjunction with the call. So
Okay.
so
When you
so
say
it
task people, you mean the same way we would in Next Tech, we just assign it to somebody on the team and your system can
100%.
automate
We
that?
do the same thing in Next Step, right? We can take a prescription medication refill request and task them. We can take a take a um oh, I mean, there's, you know we've got like 10 tasks that I know we're
Sure.
doing everything from billing, like send me a statement, to to help me reset my portal, to I need medical records sent here. Um, all of those things were based, which is just what their call center was doing, I believe, for
Yeah.
people. So,
Well, a number of things kind of come to mind. First of all, it's there's so much that I can imagine you're offering helping solve for that I want to continue I know I need to continue to learn more about how it can help practices. And that you've got practices on here who already use you, I think is bodes well. The people are loyal to want to know and see you succeed. Um, I do want to figure out how we can get more information to folks. So I don't know if you're having an upcoming webinar or something like that, but if you were, I would want to help co-promote it just because I think that people understanding, we took a lot of time on this call, getting to know you, your background,
mhm.
why the inspiration for the offering, maybe less time on the actual offering itself. But I think for folks who are on this call who I mean, either they're running a big practice or they're advising a bunch of practices or they're speaking on behalf of all of ASOA. It's worth everybody on this call knowing you're offering cold. And so I'd love to maybe take the conversation offline and figure out how we get more information out there about it. Because clearly you're striking a nerve with some people about how they can automate the mundane parts of the work in order to maximize the patient experience at the point of care, which is one of the more humane things we can do, and I applaud you for it.
Thanks for saying that. Yeah, yeah, would love to spend some time with you guys. I'm happy to put together, some materials or things that are, give some concrete examples and help people understand what we do and how we do it a little better.
Yeah, that's great. Because we want to keep this to our typical allotted time frame. We got time for probably one more question for Lawson. Lawson, we appreciate you making time. I want to just segue to what's happening next week. Next week at this time, actually, it's going to be at 2:30 Central, not 3. So it's a half an hour earlier. We're going to hear from Dr. Netta Shami and Dr. Gary Warts. They've started a program called Eye Surgery Today, and it's an online, almost video magazine or brochure about what patients need to know about each of the offerings in ophthalmology. Now, it's from doctors' perspective to patients. So it's nothing that practices out there have to subscribe to. It's nothing that we, as an industry, have to fear is promoting one technology versus another. Instead, what they're trying to do is pack the airwaves with quality information that's going to run into patients who are searching for it. It's been supported by all of our industry friends and partners, and I think it's extremely clever to try to make good education ubiquitous rather than all the information about our offerings being out there on Reddit and subgroups on social media. So be sure to come back for that. They're extremely well spoken, and like I said, it's a clever idea and very complete in its use. So that'll be next week at 2:30. And then last, I just want to send a personal thank you to you, Dylan, for not turning your camera on. If you did, across the top of my screen, it would be Lawson, me, and Cade. And oh no, I mean, like, that is a lot. That's a lot of cue balls right there. So
Keep you
it's
shining.
it's a good look, you guys. We're winning. Everybody,
I
thanks
don't
for
know.
joining. Lawson, great job and great vision. I'm excited to see where you take this company and how it helps practices, and we'll communicate with everybody how they can learn more here in the future. Thanks for coming to Practice Habits. Practice makes
Thank you, guys.
perfect, everybody.